morning, everyone. Good morning, Queensland. And today we're going to give the COVID update first, and we've got some good news there for Queenslanders, and then happy to go on to other matters. So first of all, can I say that we have 4,701 new cases, and that includes 2,347 positive rats. Tragically though, it's very difficult every day to talk about this, but we do have 19 people who have lost their lives, and once again, these are family members of people across Queensland. I can report that 10 of those were in aged care, and the Chief Health Officer will go through in detail, but only one person had their booster. So we do pass on our condolences to family members during this stage. In some positive news, we're starting to see our numbers in public hospitals coming down. So we've got 663 in public hospitals and 43 in ICU, and the Chief Health Officer will give more detail. But the good news there is that we actually think that we are really getting through this peak, that we're coming down off the peak now, which is fantastic news. So the decision to put off schools for those 2 weeks was the right decision, because we're coming down off this wave. Kids are returning to school. People are coming back to work. Those decisions that we took were absolutely the right decisions. I'm more than confident of that. And because we're coming off the peak, we can also announce today that people will not have to use the check-in app any longer. I know there'll be welcome news to many places across Queensland. The Health Minister will go into more detail. You still will have to show vaccination status at pubs and clubs and cafes, and the Health Minister will go through that. So that's good news that we're able to bring about that change today as well. So in terms of vaccine coverage, 92.18% at least one dose and 89.94% double dose, which is great news. Boosters, 1.6 million Queenslanders have received boosters, which is 58.37% of the eligible population. And of course, we still would like to see more people getting their booster shot. So if you are due, please go and get that. 5 to 11-year-olds, 39.19% of children have had one dose. So thank you to the mums and dads and the carers and grandparents and aunts, whoever's gone to take their children to get vaccinated. Thank you very much. And of course, we've got those changing conditions today in our schools, and we do wish the school community all the very best, and we know that Queenslanders are used to wearing masks, but it is important that in those school settings that the rules around masks are observed. So back to school and back to work, and that's good for our economy. It gets people back into the workplace, and as the Treasurer said, it continues to grow our economy. So I'll hand over to the Chief Health Officer and then the Health Minister, and then we'll take some questions. Thank you.
Thank you very much, Premier. Sadly, we have 19 deaths to report today. This includes one person in their 60s, 5 in their 70s, 9 in their 80s and 4 in their 90s. 9 out of these 19 people were not vaccinated. 1 had received 1 dose of vaccine, 8 had received 2 doses of vaccine, and only 1 of the 19 had received a booster. 10 of the 19 were known to be aged care residents. That brings a total of 151 Queenslanders who have been recorded among deaths in aged care to date. So again, our thoughts are very much with their families. In terms of the hospital situation, as we've seen over the last few days, the number of patients admitted to Queensland Health hospitals has declined very steadily. Today we have 663 people in hospitals. That's the same as yesterday, but I might remind you that we typically see this 7-day cycle where on Mondays and Tuesdays reflects the number of people that were discharged over the weekend. So the fact that today's number is not down from yesterday is not surprising. The trend, though, is rapidly down across Queensland, and we're expecting to see that trajectory to continue throughout February. So there are 41 patients in ICU, 24 of them ventilated, And our private patients, there are 61 patients with COVID, including 2 in ICU, so that was down from 63 yesterday. I'll hand over to the Minister. Thank you.
Thank you. So I also want to pass on my condolences to the families of those individuals who have passed away who have tested positive for COVID. It is concerning that 9 of the 19 were unvaccinated and only 1 of the 19 had had a booster. So again, I put a call out for everyone who is eligible for their booster to come forward and get that booster, no matter what age you are. But I particularly want to put a call out for aged care staff. I think all aged care staff, people working with people with disabilities, in vulnerable settings should be coming out and getting their booster as soon as possible. And of course we want to see a continuation of people in residential aged care and disability getting their boosters as quickly as possible as well. And if families do have relatives in aged care or nursing homes where they can take them out of the facility, our vaccination clinics are available for walk-ins if anyone wants to walk in with their relative and get a booster as well. Of course, so can community pharmacies, and of course you can book in for GPs if your facility hasn't got a vaccination yet. We still want to see the 12 to 15-year-old and the 5 to 11-year-old vaccination rates coming up. 5 to 11-year-olds is under 40%, and our 12 to 15-year-olds is only at 68.7% double dose. So I do want to ask parents to keep coming out and getting their children vaccinated. It's great to see that our number of staff that are quarantining or isolating has come down considerably. Today's figure is 2,419. Now that's down from a peak of 6,049 on the 18th of January. And that just shows the trend that we are seeing. And the great news is that all of the data that we have and the modelling that we have seen is it appears that we hit our peak on the 4th of February. So the last region, which I believe was Townsville, hit its peak on the 4th of February. So we are now showing declines across the state, or stabilisation of COVID cases across the state. That doesn't mean that we still don't have pressures in some of our hospitals with high hospitalisation rates, and we are still seeing that in some of the regions, and also high ICU rates, but they are far lower than what our modelling showed that we could have expected, and that is because of the great work that Queenslanders have done, both staying home and working from home, the social distancing, the good hygiene, the mask wearing, and of course getting vaccinated. And to all of our parents who kept their children home over the last 2 weeks and the delay of the school term, it has made all the difference. By pushing back people returning to work until today, pushing back the start of the school year has allowed Queensland to ride the peak and start seeing a decline in COVID hospitalisation numbers, which is fantastic. Which is why today we can announce a shift away from check-in apps for all businesses and venues that don't have a mandatory vaccination for their customers and consumers. So businesses such as clubs, hotels, and those venues will still operate the check-in for the purpose of confirming vaccination status and allowing us still to ensure checking of compliance with the mandatory vaccination. For all other businesses from today, immediately, they will not require a check-in app. Now that means taxis and rideshare, that means retail, supermarkets, it also means hairdressing, beauty therapy, gyms, many of those indoor play centres, real estate and auction houses, indoor sports centres, all of those areas will no longer need, and any part of government buildings or services where the public ordinarily have access will not need to check in now. This is a great step forward, and it shows the success, and our analysis of the data of hospitalisation and ICU and even deaths has shown that we have managed this virus through the Omicron wave better than our larger states across the east coast of Australia. And it really comes down to the great work of Queenslanders following the health advice and doing the right thing, and I want to thank every one of them for doing that. Thank you. So we can probably release what the figure is to date, so I'm happy to, I can report on that tomorrow, what that total number is. We do have still people who are, I won't break that down to regions as respect of the families, but I will be able to say the total number of First Nations. And certainly in those regions where we're seeing the hospitalisation rate matching the modelling, and there is only probably the Cairns and hinterland that have shown that really high trend still. It's very much coming down to our First Nations community and the vaccination rate. And my message is still the same. It's not too late to get vaccinated. It's never too late to get vaccinated. Even if they haven't had their one dose, come out and get vaccinated now. It will make all the difference, and it puts everyone on that journey to getting to that booster and making them even safer. So we are so close to the 90% double dose. Can I put a call out for everyone who's due to get their second dose? Help Queensland get over the line today by going out and getting vaccinated at any one of our clinics or GPs or community pharmacy. 89.94%. We are that close to getting 90% double dose, and Queenslanders can help us get there today.
Businesses, many of whom still have to do the check-in, that they will probably not be very happy that they still have to do the check-in and say that a lot of people aren't doing it anyway, and this will going to lead to more confusion with some and having to do it with some not. Why not just scrap it all together?
Because we are still requiring mandatory vaccination for customers and consumers in those high-risk settings. Now, by maintaining that, it is actually the easiest way for businesses and compliance officers to ensure that people are meeting that mandatory requirement, because we have that data of who has been on site, what consumers have accessed that site, and their vaccination status. So it is the easiest way. Businesses are still having to ask people whether they're vaccinated or not. So that check-in is actually helping them do that. That high level of non-compliance is really in those other settings. I have to say, our cafes, restaurants, clubs, pubs have done an amazing job of compliance. Where I'm seeing the low compliance was really, in those bigger retail settings and supermarkets where people were having to check in every shop that they were going into, and that's where we'll take that burden away and be able to go back to not needing that check-in at all, because Queenslanders have done such a great job.
If you use another method, so the Medicare app, you can bring up your vaccination status, do you still then have to check in?
Yes, so we're going to require the check-in for those businesses that require, so it's in Schedule 1A of our Social Measures Public Health Directive, those businesses that require mandatory vaccination for their customers and consumers to keep using the check-in at the current time, because that is the easiest way for our compliance officers. If it's simply the business showing, being seen, the tick or the certificate, our compliance officers are not going to be able to go in and check confirmation that every single person has accessed that business had been vaccinated. But with the check-in app, they can do that.
So is that saying then that the check-in will remain as long as the vaccination?
No, we're just saying at this stage, this point in time, schools going back, people going back to work, we'll have a lot more people travelling on public transport, moving around the community. Let's just see how we go. But it is a huge step forward for us to be able to lift the check-in app for many, many businesses across Queensland.
Just on that point, how long is the government envisage that the mandatory vaccination rules will be in place for these locations?
Look, we will continue to review this, but we are, as I say, just coming off the peak now. Schools just going back, people going back to work, a lot more people are going to be circulating. We're hearing the Commonwealth are likely to announce changes to international arrivals, which means a lot more people coming from overseas. So let's just see, watch what happens with any spread of the virus and whether we see an uptake of cases again. But we'll continually review it and take the health advice. Pardon? I'm not going to second guess what the health advice is, but we do know this has been a huge contributor towards reducing the spread in our community, and we should all be grateful. I know, especially in the heat of summer in Queensland, they're an inconvenience, but if it means a lot less people getting seriously ill and ending up in hospital and ICU, it's worth it.
Are schools prepared for when teachers and students have to isolate when cases start coming up?
Look, all of that planning has been done by Education Queensland. They have a pool of relief staff that they can call in at short notice to fill in for teachers. They have plans in potentially consolidated classes if need be to ensure that they can manage any shortage of staff. So they have worked through this, and those extra 2 weeks that we have given given education to work with health and work out those strategies have made all the difference to make sure that they're planned well for this.
Are you expecting cases to start appearing from this week?
Look, I think the Chief Health Officer has said a number of times now, we expect there'll be cases because of kids going back to school and because of people going back to the workplace. But thankfully, that is not happening at the same time as we were peaking across Queensland. So we've been able to see some of that pressure coming off our hospitals while we expect we will see extra cases occurring. And that's a really good thing. If all of those had come at once, we would have seen much higher hospitalisation rates and more pressure on our system.
Can we ask a couple of questions? Yeah, sure. Will the government release all the reports that were done on summer or in the wake of the private email?
I've heard reports about the one which has, I think it's the recommendations. Look, I'm more than happy. We just need to check with the CCC, but I'm absolutely happy for that report to be released. I have no problem. So we'll check with the CCC, and as soon as if there's any issues there, if there's no issues, we'll immediately release it.
Can you clarify, was that Mr. Summerall saying that there was a report, 2 reports he did essentially, one that went to the Director General and another that went to the CCC. Did that one that went to the Director General also go to the CCC?
That's what we need to clarify. So as soon as we can clarify that, I'm happy for the report to be released.
And do you know what recommendations still haven't been enacted upon?
Well, what I was advised was that all of the recommendations are either have been completed or underway. So there was nothing that was outstanding to commence work. Yeah.
Yeah. Is it clear on those recommendations around making changes to the Public Records Act? Given the report was handed to government 5 years ago, do we expect to see that legislation before Parliament soon?
I understand that that review has been initiated. I think it needs to be a comprehensive review. I think the Attorney General also advises me that the RTI Act is under review as well. I think these are robust systems of government when acts do get reviewed. So, sorry. The RTI Act would be under the Attorney General's Department, and the Public Records Act would be through Minister Enoch. And I think there's also like a Public Records Advisory Committee, so they would also be involved in that.
When do you expect that review?
I would hope that both will be into Parliament this year.
When do they begin?
Sorry?
When do they begin?
You'll have to check with the individual ministers.
I think the inquiry says that the PCCC inquiry won't be broadened to include integrity matters that have been raised. So does this mean that you'll be...
Sorry, I didn't hear the first part of the question. Yep.
The PCCC scope won't be broadened to include these other integrity matters. Does this mean that you'll be looking to hold a separate inquiry or look into these matters separately?
Into which particular matter?
All of the integrity matters.
Well, there's been a number of issues, and as we've said at length over the last week, they have either been actioned or there are processes in place. And you know, the public needs to have confidence that we have the mechanisms in government for people to have their views raised, but also to have those matters investigated. As we've said in relation to the Integrity Act is currently with the Economics and Governance Committee, and hopefully they'll report to Parliament soon, and then government will be able to respond to that. But can I say this? Look, I do expect high standards across the public service. I think, and I'll say it again, I believe that our public servants, I value them, and what we've heard over the last week, I acknowledge that some things could have been done better. And I want to reiterate that I do want the highest standards in my government. So I have written to my Director General and I've asked her to convey to all public servants that about my expectations, but also that there are mechanisms and ways in which if they do have any issues, that they should feel confident in raising them. So the letter from the Director-General will also be issued to public servants today.
We heard the Deputy Premier accuse the principally of mudslinging. Can you just clarify, what is the government saying the opposition is, what mud is that the opposition slinging that hasn't come from allegations raised by those public servants?
Well, opposition's, I've been in opposition, so, you know, it's a bit looser. In government, you've got to get your facts right. And
what facts have they got wrong, though?
Well, there has been a few. I don't have them all here in front of me. But look, I want the public to have confidence in our robust institutions that we have in this state. And like I said, the Director-General will be writing to all public servants today, reminding them about their obligations to report if they've got any issues. And we want to make sure that we empower individuals that work in this organisation.
You said things could have been done better. What do you think could have been done better based on what you've heard?
Well, obviously some people have some grievances and some people don't think they were listened to, and I don't want that. I don't want that. I want them to be able to listen to, and I want to make sure that the matters that they raise are investigated. And I might just add this too. So in relation to some of the issues that the archivist has raised, you'll know that a QC is looking at those issues. My Director-General advised my Chief of Staff this morning that she does not want there to be any perceptions of conflict. There have been some reporting that she is my staffer. She is not my staffer. She is the head of the public service. She is a very capable, competent woman. She is the first Director-General, the female Director-General in this state. But she does not want to have any perceptions of conflict. So what will happen now is that QC's report will be done completely independently at arm's length from the government, and as soon as that report is completed, it will be immediately released. It will not be looked at by government, it will not be looked at by the Cabinet, it will be immediately released. I want the public to have confidence.
I'll ask a couple of things.
Did that report also look into allegations made about the Public Service Commission in relation to the Integrity Commissioner?
This is in relation to the archivist, but in relation to the Integrity Commissioner, I think we just have to let the processes run its course there. I have the absolute respect for the office of the Integrity Commissioner in this state. It serves a very vital function. And I have respect for the current Integrity Commissioner, and she's still there till July. I'm sad she's leaving. She could have extended that if she wanted to. But at the end of the day, we just need to let the processes take its course. And of course, we've got that review happening at the moment with the committee. And of course, the Integrity Commissioner can provide any information she wants to that committee.
And you're still comfortable with the fact that the only organisation that's looking into allegations against the Public Service Commission is the CCC, which is undergoing inquiry?
But the CCC does a whole lot of work. I mean, the CCC does investigations into organised crime. Those functions are still happening as we speak. They serve a vital role in this state. The Fitzgerald inquiry is looking in particular the recommendations that came out of the bipartisan PCCC committee, which is looking at what happened with the Logan City Council. But this is about making sure the public has extra confidence in the CCC. It is important that we have an anti-corruption watchdog in this state, and that's why I welcome the work that Tony Fitzgerald and Alan Wilson commenced today. Yep, sure. Thank you.
Some jurisdictions are collating and releasing the number of cases within school-age children or cases in schools. Is there any merit to that? Will we be doing anything similar?
Well, we'll be doing statewide reporting on infections in school-age children, hospital admissions in school children. We're not going to be doing it by individual school.
So you're happy to release on a daily basis a number of cases within schools?
Well, it'll be school-age children probably, so it'll be, yes, so effectively that will be what we were collecting data on, and we already collect that data.
So, on aged care, quickly, you have those numbers about the number of people who have passed away in aged care, specifically unvaccinated and not having their boosters. Do you have that data for those people who have passed away in aged care facilities in that 19?
Sorry?
When you mentioned the deaths in aged care,
yes.
The significant number, do you have any data on how many of those hadn't received a booster or were unvaccinated specifically in aged care?
For today?
Yes.
No, I don't. I have it, but it's not on this document I have here.
More broadly too, we've seen a large number of deaths in aged care. some will be too early to know the exact cause of death, but obviously there's a lot of comorbidities often in aged care, especially for those earlier deaths in aged care. Have we seen any more data or patterns emerge showing whether COVID was actually the lead cause of death or with other issues?
There is no doubt that it is very difficult in elderly patients with multiple comorbidities to establish exactly what the cause of death is often. That's very common. Sometimes you can never be certain what the exact cause of death is. But what I would say is we're seeing a disproportionate a number of elderly people dying who have not received the booster. That is the concern that I have. So of the elderly age group that have died, it is sometimes very difficult to work out whether COVID was a direct contributor to their death or was the major cause of death. There will often be multiple factors involved.
Is that reflected also in aged care? Or
Sorry, say.
With the peak starting to wane in Queensland, is that also reflected in aged care, or do you think there will be a lag in the numbers?
Well, in terms of, if we're just talking about deaths, for example, typically the peak occurs first of all in transmission in the community, then admissions to hospital, intensive care admissions, and deaths is often the very last measure that starts to decline.
You said there was a sense of nervousness among hospital staff. What's the feeling now in hospitals?
We visited a few hospitals, and I think there's a great deal of positivity in hospitals. We've visited a number of hospitals, the Minister and I would say that the morale is high.
When these people die in aged care,
last one.
When these people pass away in aged care, are they passing away in the aged care homes, or are they passing away in hospitals?
It's a combination of both. So the data I'm reporting are people who are resident in aged care.
Do you have any concerns about the treatment they're receiving at aged care homes versus hospitals?
No, that's not actually my concern is more about the boostering rate. That's principally. I mean, I must emphasise, and it is important to say, people do die in aged care. That is the nature of the environment, and you have people who have. There is a high mortality in aged care because you have people with a lot of medical problems, and sorting out how many of those individuals have died as a direct cause of COVID-19 is often very difficult. It's just the fact there's a disproportionate number who have not been boosted that is concerning me most of all.
Okay, thank you.